Puberty, PMS, postpartum depression, and perimenopause aren't talked about enough. For this episode of the Pulse Podcast, I sat down with Allyce Jones, the program director of RMU's Psychiatric Mental Health Nurse Practitioner program, and spoke about hormones and women's mental health. It's a conversation that can benefit the women we care about. Let's dive in. Welcome to the podcast, Allyce.
Hello, nice to see you.
Yeah, we're happy to have you here. And today we're speaking about women's mental health and reproductive psychiatry 101.
Yes, a topic I'm very passionate about.
What got you so interested in this topic?
Oh, I was working as a nurse on an inpatient unit and getting my psychiatric mental health nurse practitioner degree. And I noticed that there were a lot of patients who were coming and they weren't necessarily getting care tailored to someone who's breastfeeding or someone who's postpartum. I also started to have a lot of friends in this period of life, and I thought someone needs to be treating them and knowing about specifically what meds they can take, what meds they can't take, and what are the risks and benefits so that they could make informed choices. So I didn't think that there was anyone doing something like that in Utah, so I ended up doing a one-year fellowship after my doctorate in women's mental health in Cleveland, Ohio.
Oh, that's great. And so if you could just kind of give us a brief overview of what exactly reproductive psychiatry is.
It's mental health in general, and just the idea that hormones play a big role, the big hormone changes for a lot of women, menstruation, and then the cyclic hormones that end up coming with that, pregnancy, postpartum, and then perimenopause and menopause. And we know that the hormones impact the brain a lot, so we need to have specialized treatment available for the people who are impacted by that.
So this is something that you introduced in Utah at your practice and you're doing now. How has that been received?
I mean, there's a lot of need and a lot of pregnant people, a lot of postpartum people, a lot of perimenopausal people, so it's a busy practice. Someone else started out doing something similar right around the time that I started my practice, and there's always need for more people doing this.
Yeah. Well, it seems like female hormonal changes are often focused on the physical symptoms and maybe not quite as much the mental health component. So why do women need to focus on that mental health aspect, and why is that so important?
Sleep, cognition, mood, all of these things impact daily life all of the time. And if you think about all the hormonal changes in pregnancy and the physical changes, growing a baby, changes in sleep, and all of the things, all of those changes are also happening in your brain.
So what are the major stages of women's hormonal health, and how does each one affect a woman's mood and brain throughout her life?
It depends on the woman. Some women are not impacted by reproductive transitions, and some women are. But it seems like sometimes pregnancy can be the flip that switches it on. So from then on, you end up being impacted by hormonal changes. I see lots of people who stop birth control after their husband gets a vasectomy, and they have just always used birth control, so not had just the normal monthly cycles with a lot of hormone shifts. And then they're having them, and they didn't realize that it would be a problem for them. Hormones impact serotonin, they impact dopamine, they impact GABA.
I kind of wanted to walk through the different stages of women's hormonal health and how does each one affect a woman's mood and brain. So maybe start with puberty and progress from there.
We know during the reproductive years, which is roughly age 10 to 55 for a lot of women, women actually have double the rates of anxiety and depression. And puberty, that awkward time of life when everything is changing. People get acne, there's often lots of mood swings, but that's when the hormones are turning on, the sex hormones, and people start noticing the difference, maybe being more emotional before a period starts. And then people will continue with the monthly cycles throughout their life. So switching to PMS and PMDD, we know that up to 90% of people experience some type of PMS symptom, bloating, cramps, headache, fatigue, but also irritability, sadness, crying. So lots of people are experiencing some sort of symptoms in conjunction with their menstrual cycle, PMS, there is a subset of women, thought to be around 4 to 8% of women, who have premenstrual dysphoric disorder, or PMDD, where the symptoms around their cycle impair their functioning at work and at home. Often they have symptoms of irritability. There's often lots of conflict specifically with their partner. Lots of people get really overwhelmed at work, and maybe they have more conflict with coworkers or other things. People might be having a lot of physical symptoms at the same time. It's also a more common time for women to have suicidal thoughts and self-harm thoughts. So it's happening cyclically, monthly. So although some people can predict it, a lot of people don't catch on to the monthly cycle because it happened 4 weeks ago. So they're not necessarily remembering what happened 4 weeks ago.
Are there lifestyle changes women can make to help with those hormonal changes?
Yeah, we know things like aerobic exercise can be helpful, minimizing caffeine intake. Yeah, I mean, all of the lifestyle modifications are very challenging. Other people will use medication management, something like birth control or oral contraceptives, to minimize the hormone fluctuations that are happening every month. Some people take selective serotonin reuptake inhibitors, which are actually thought to help the conversion of progesterone to allopregnanolone, and can actually start working in just a few hours for PMDD compared to the 4 to 6 weeks that they will often say they take for depression. So those are some other things that we commonly use for PMDD. And I think psychotherapy is helpful for a lot of things, and it can be helpful for PMDD.
Yeah, you had mentioned that in preparing for this, the postpartum depression gets the most attention, but the reality is that many cases of depression actually start during the pregnancy. Is that mostly hormonal, and what can you do to help with that?
I think some of it is hormonal, and I think some of it is physical. I mean, just feeling nauseous all of the time, feeling tired, the body changes, the body image changes, and the anticipation of knowing you're growing a human and you're going to have to take care of this human and you're going to have to get the human out of your body somehow. All of those things can cause a lot of anxiety and also depression.
And the postpartum depression is a serious thing that happens to some women. Is there anything that they can do, like screenings or anything during the pregnancy, to maybe combat that as well?
I think we are doing a lot better at screening. Lots of people, when they're seeing their midwife or their OBGYN, are getting screened periodically throughout their pregnancy and hopefully postpartum. But the EPDS, the Edinburgh Postnatal Depression Scale, I think is the best one for pregnancy. Lots of the normal depression scales ask about, like, are you having changes in your sleep? Are you having changes in your appetite? Which we know happen in pregnancy, so they're not necessarily helpful questions. But some of the questions on the EPDS are like, are you so sad that it's impacting your sleep? Not like, is it because of heartburn?
What are some mental health issues during pregnancy that women should be aware of, and some solutions?
So all of the mental health issues can happen in pregnancy or worsen. ADHD symptoms can get worse. People can have new onset of OCD. Trauma symptoms that have happened in the past or new trauma symptoms can pop up. Anxiety, depression, psychosis, all of the things can happen in pregnancy or postpartum, but it's such a vulnerable time that often the symptoms are really magnified, so requiring a lot of treatment. But it's actually a great time for people to get treatment because they have so many touch points with healthcare providers. They're going to their OBGYN or midwife regularly during the pregnancy. After the pregnancy, hopefully they see their OBGYN or midwife, but they're also seeing a pediatrician. Lots of pediatricians now are screening parents for mental health concerns too.
Are healthcare providers learning more about the mental health issues, and is that something you would like to see even more emphasis on that?
Healthcare workers in general are learning more. I think there's lots of great educational materials out there, but I don't think it's standardized into the curriculums for all healthcare providers. So especially people who have been out of school for a while. They might not know this information.
I'm curious, I've had 4 children, and I'm wondering what's the man in the life or other people who are around the pregnant woman, what can they do to be alert and aware of potential depression issues? How can they help? How can we help?
I mean, I think everyone being aware of things, often it just looks like the woman not feeling like herself, not acting like herself. So knowing about resources, often people who have experienced similar symptoms can be helpful to talk to and find out what resources worked for them and help connect them with other people. There's also large organizations like Postpartum Support International that has a text line. They have a phone line. They have local chapters and groups every day. So lots of access to resources if needed.
Yeah, because it seems like it could be, I mean, obviously it's a huge burden to carry. It's probably a lonely journey as well, and you're inside your head a lot and carrying all this guilt and all these other, a wide range of emotions. So reaching out to get support, I could imagine that's really invaluable.
Mm-hmm. Another thing I like to tell all parents about is scary thoughts. 90% of women have scary thoughts about the baby. A lot of men also have scary thoughts, whether that's, what if I accidentally hit the baby's head while I'm walking down the stairs? What if I accidentally drop the baby? And also some people have these thoughts about, what if some of these things happen on purpose? And that can be really distressing to people because their babies are very precious and wanted and loved. So to have something like that come up in your mind can be very upsetting. But that's something that I think goes along with postpartum depression and that not everyone is aware of.
Okay, thank you. So after the reproductive stage, which lasts for decades, then you move into a perimenopause. Can you explain what that is and how a female's body adjusts to that?
So perimenopause is kind of like reverse puberty. If you think about all of the changes that happened in puberty, some of them, all of those body systems are changing. Again, it's the end of reproduction. Your estrogen levels are going down, your progesterone levels are going down, and your cycles also become very unpredictable, which can be distressing if you have been able to usually count on like, okay, day 24 is usually hard for me, and day 25, and then things are better. But if your cycles are lasting 14 days or 60 days, then it's really hard to predict when those transitions might be coming. And also the changes in hormones are impacting sleep. Brain fog is one of the top things that we hear about in perimenopause. Staying asleep, skin, hair, all of the body systems are impacted.
A lot going on. You had mentioned the women might be part of the sandwich generation. What do you mean by that?
So middle-aged women, they just have a lot on their plate. They could be caring for elderly parents. They could be caring for teenagers or young adults who need a lot of attention. They could also have leadership roles at work. They could be navigating empty nesting. They could be navigating financial concerns. They could have a new chronic health condition. This is when lots of those things start popping up. So having all of those things happen and also not feeling your best at the same time can be challenging. And some people have symptoms for several years. So it's not like, okay, 2 months and then I'm feeling better, but maybe it's 8 years and then I'm feeling better.
Yeah. So after perimenopause, women enter menopause, and you've provided a fascinating statistic that 6,000 women enter menopause every day. That's 1.3 million.
Yeah,
that's a lot.
So it's a huge topic and a huge area of the population. Unfortunately, we don't have a lot of research because people don't care about women. That's the truth. Lots of people will start on hormone therapy. They used to call it hormone replacement therapy. Now they've shifted to calling it more menopause hormone therapy or just hormone therapy. We're not necessarily replacing the hormones, just stabilizing them. And one of the newest updates is the FDA is taking off the black box warning for hormone therapy in
Yeah.
perimenopausal and postmenopausal women, which is a very exciting update. And we know that these hormones are important and helpful for a lot of people for heart health, for brain health, for bone health. So we're hoping that a lot of women can be helped by having the black boxes removed.
Are you recommending because this just is happening this week?
Yeah.
Are you recommending that women reach out to their PCP, their physician, to see about hormonal therapies that might be available to them now?
Yes, you can reach out to your primary care provider or your OBGYN gynecologist. And if they're not helpful, and it's true that there is a big gap in knowledge amongst healthcare providers about caring for women in perimenopause, then you can hop onto menopause.org and find a provider who has specialized training in caring for women who are perimenopausal or menopausal. But it's true that lots of women get minimized. Their symptoms, or like everyone goes through hot flashes, but some people are very impacted and it impacts their daily life, and there's effective treatments that you can use that are helpful. Other treatments besides menopause hormone therapy, people will use low doses of antidepressants, which can be helpful with hot flashes, sometimes helpful with insomnia and other things, and always the lifestyle modifications that can be helpful for a lot of people.
So how can doctors, women, and families improve care and awareness?
I think doctors and healthcare providers just need to make sure that they're up to date on the latest information that we have about treating people in pregnancy, treating people in postpartum, PMDD, and perimenopause. It's not something that's always covered in training, so often people do have to go out of their way to find this information. For family members, friends, and women themselves, I think just being aware of the changes. There are lots of great resources and books. And also knowing that in some ways it's a positive, especially menopause. One of my favorite books is called The Upgrade, but it talks about all of the benefits of not having a period anymore. It's actually, the evolutionary hypothesis is the grandmother effect or something. So when you're not reproducing anymore, you can turn your attention to your grandchildren, and you're not continuing to have kids when you're 60 and 70 who are competing with your grandkids. But I know being a grandparent can be some of the most satisfying times for a lot of people.
What is new in research for women's hormonal mental health?
I mean, the FDA change is some of the new and exciting things. Another one is the new postpartum depression med that was just approved last year, zuranolone, which is a 14-day medication that people just take one time. It's a neurosteroid, and it's a derivative of allopregnanolone, which is found in very high levels in pregnancy. And then you have the baby and the levels drop very quickly. So it's kind of some way of resetting that system. And the fact that it's 14 days, it's not a medication that you have to take forever. It's a medication that you can breastfeed while you're taking. It's sedating, which can be helpful for a lot of women. Just getting some good sleep in the postpartum can be nice. But just having a different treatment option is very promising. And lots of people start feeling better on day 3, which is also amazing because lots of meds, it's like 4 to 6 weeks, you might start feeling better. And that's a long time if you're caring for a baby and have other responsibilities going on.
What's a big myth in this area and maybe your hope for the future?
I would say mental health changes associated with reproductive changes or shifts, they're treatable. It's not just being part of a woman. If your symptoms are interfering with your daily life, then there's things that we can do to help you.
And what's your hope for the future?
I'm hoping that healthcare providers can be knowledgeable and aware about these changes. I'm hoping women can be empowered to find the information they need and also advocate for their healthcare needs, even if it means finding a second or third or fourth provider who will finally listen to them. But those are my hopes.
Are there any other resources that you could suggest for women?
I think Postpartum Support International is a great resource for pregnancy and postpartum. Menopause.org from the Menopause Society is a great option for perimenopause. And IAPMD.org is a great resource for premenstrual dysphoric disorder.
I'm curious, in your work with reproductive psychiatry, if you've had an experience or two where you've seen just tremendous growth that you would be willing to share.
I think a lot of the change is just listening to people, listening to their symptoms, knowing that it's something that I've had before and it's actually quite common, and that there's a treatment option can be very helpful. Lots of people will say, I've always thought I was crazy, or no one has ever asked me these questions, or no one has ever listened, or no one has ever said they think they can help with these things. And they're very distressing and debilitating things. So just giving them hope and giving them resources and treatment can be very helpful.
Oh, that's really awesome. That must be fulfilling to know that you're filling this gap here for people.
And otherwise, treating people in pregnancy, I mean, a depressed or anxious pregnant person on top of the physical symptoms, it's a terrible way to be feeling, but if we can help them with bonding and attachment with the baby, help them feel better, it ends up helping the whole family. So that's another thing I like about reproductive psych. It's not necessarily just treating one person. It's treating one person who impacts the whole family and impacts the whole community.
So what are some practical ways to support women through pregnancy and postpartum?
We used to live in villages and now we don't. So there's lots of things that can be helpful, from meals, cleaning, although people don't often like to ask for help with cleaning. That's often something that gets neglected when you're caring for a new baby. Help with someone holding the baby, help with picking up the groceries. There's so many little things that people can do to be helpful. And what's not helpful is just saying, let me know if you need anything. What is helpful is saying, hey, I can bring you dinner on Tuesday. I'll bring it at 6 p.m. Do you have any dietary restrictions?
That's a great point. Don't just leave it open-ended. Make sure you're kind of forcing the action to happen.
Yeah, you're putting a lot of stress on someone who already has a lot on their mind if you're like, anything I could help with.
We have reached the rapid fire question round. So I'm going to give you a question, and then if you just give me the first thing that pops in your head. All right?
Sure.
If you could switch careers, what would you do?
Be a YouTuber.
Any particular angle?
Food.
What's the best piece of advice you've ever received?
Or I would work at Buc-ee's. I'm planning to apply at least. Yeah. Watermelon cotton candy, that's what you have to get.
What's the best piece of advice you've received?
To invest 10% of your income back in yourself.
Smart. If you could have a superpower, what would it be?
Floating. Not having to wear socks or shoes. It would save a lot of money.
Float over to Buc-ee's. What's a skill you'd like to master?
AI. I'm trying to learn a lot more about it.
What are you streaming, reading, or listening to in your spare time?
The Money Guys podcast.
Nice. 10%. And finally, what word would you use to describe yourself?
Awkward.
Well, I think you're delightful, so we're going to go with that word. But delightfully awkward. That's how I am as well. So on that note, thank you, Allyce, so much for joining us and sharing your expertise and all these really helpful insights on an important topic.
Yeah, thank you so much.
You're welcome, and thanks for tuning in to The Pulse.